1,203 confirmed cases in the DRC, and the response just added a continent-wide coordination team, while doctors on the ground warned this outbreak could last. If you're just joining us, DRC's Bundibugyo outbreak has been spreading through conflict-hit eastern provinces, where displacement and mistrust slow down almost every part of the response. Before today's report, Congo was at 1,155 confirmed cases and 304 deaths, with surveillance still showing week-on-week growth in community transmission, and teams stretched by access, capacity, and security problems just trying to keep up.
This is Ebola Watch. Today, a case in France, a new command team in Kampala, and doctors finally saying out loud what the numbers have been screaming.
Let's start with that snapshot, because it's the clearest read we've had all week.
We'll keep tracking DRC Bundibugyo Ebola outbreak. Follow the show so the next update finds you.
Here's New Street Live.
The Democratic Republic of the Congo, DRC, has reported 1,203 confirmed cases of Ebola, including 321 deaths, since the outbreak was declared in mid-May, according to the latest report released by the country's public health authorities. According to the report, released on Friday, local time, 148 patients have recovered, while 419 patients are in isolation or receiving hospital care. Health authorities also identified 265 suspected cases, including 77 deaths.
The headline number is 1,203 confirmed cases and 321 deaths. But a few lines down, the same report lists 265 suspected cases with 77 deaths among them. Those are in a separate column for a reason, and I want to keep them there.
And 148 recovered, 419 still in isolation or care. Carer, 6 weeks ago this outbreak didn't exist. From 0 to 1,200 since mid-May.
That's the pace we have to sit with. Tedros said it plainly Friday. Contact tracing is reaching more people, more patients are going home, but the follow-up rate is still below the 95% target.
20 isolation centers short. Treatment centers in Ntuli near saturation. You can trace all the contacts you want. Where are you putting them?
And this is where politics and security stop being background noise. War and insecurity are slowing the response. Mistrust around post-mortem testing. Tedros named both. Doses and supplies don't move easily where armed groups do.
So the honest answer to, is it getting better, is more people are recovering and the count is still climbing. Both of those are true at once, and neither one cancels the other.
This one's from CDC.
To date, no Ebola cases associated with this outbreak have been reported in the United States. The likelihood of Ebola spreading to the United States is considered very low. If a case was diagnosed in the United States, the risk of Ebola spreading in the United States is also low due to the strength of our public health system and infection control measures.
So the CDC page is dated June 26. That's an actual refresh, not the May alert sitting there, and it still says, risk to the American public and travelers remains low. We just said confirmed cases are past 1,200. I want to know whether that low line has actually caught up to a multi-country, 4-province outbreak.
It can still hold and be incomplete. The page lists DRC and Uganda as the geography. Kampala, North Kivu, South Kivu. What it doesn't name yet is a confirmed case in France.
Right. So a refreshed page from 3 days ago already trails the map. If you're connecting through Paris this week, very low likelihood of spreading to the United States isn't quite the answer you're looking for.
Here's the distinction to hold on to. No cases confirmed in the U.S. is precise and true. Risk remains low is a forecast. Daniel's right that the forecast is the part the week keeps testing. One more thing the page is straight about. This is Bundibugyo, not the Zaire strain. No licensed vaccine, no approved treatment. That's why strong public health system is doing the reassuring here. because there's no shot to fall back on. France 24, with Mama Barthélemy Bangura.
While France confirmed its first case of Ebola, reports of people successfully treated for the condition are also emerging from Mongwalu, the epicenter of the epidemic in the eastern part of the DRC. Although successful treatments are sparking hope among teams on the ground, health professionals remain fearful about the continued progression of cases.
The doctors on the ground are finally saying it plainly. This epidemic will last. We had the count top 1,200 a minute ago. Now the warning matches the curve we've been watching all week.
And France 24 puts two things in the same dispatch. France confirms its first case, and Mongwalu, the epicenter, is sending patients home recovered. I want to keep those apart. They mean different things. One is spread, the other is treatment access.
Hold on, though. Successful treatments emerging from Mongwalu. There's still no approved specific therapy for Bundibugyo. So what does successful treatment actually mean here? Supportive care and a patient strong enough to pull through?
3 people walked out of that hospital on June 16. A man, a woman, and a child. One of them, Florence, is the hospital's own accountant. That's supportive care done well and early, not a cure. Real, but don't extrapolate it to 1,203.
And the case in France is the first time this outbreak crosses into Western Europe. The CDC page we just hit still says, low risk to the American public. The virus is on another continent now. At what point does that language age out?
One confirmed case isn't sustained transmission, Daniel. But here's the practical edge. France's standard rapid tests are tuned for Zaire Ebola virus. This is Bundibugyo. I'd want to know exactly which assay French clinicians use to catch it. Ntuli Kapologwe, with Ntuli Kapologwe.
Today, 27 June 2026, I had the privilege of giving remarks at the launch and operationalization of the Continental Incident Management Support Team, IMST, in Kampala, Uganda. This marks a historic milestone for Africa, significantly strengthening the continent's capacity to prepare for, coordinate, and respond effectively to the ongoing Bundibugyo Ebola virus disease, EVD, outbreak, as well as future public health emergencies and disease outbreaks.
The Continental Incident Management Support Team launched in Kampala on the 27th. 11 African countries at one table for a single outbreak. It's the first concrete coordination structure we've had to point to all week.
Okay, but Kara, it launched in Kampala for an outbreak whose epicenter is in the DRC. An incident team headquartered across a border from the actual fire.
And that's exactly why it matters. Putting a DRC outbreak response team in Uganda is operational, but it's diplomatic too. Kinshasa and Kampala coordinating at all matters for disease control, given the corridor instability driving displacement.
So my question is whether this reaches Mongwalu, where the doctors we heard earlier are saying this epidemic will last. 11 flags in a conference room in Kampala is solidarity. Does it move anything in the epicenter?
Honestly, we don't know yet. The launch tells us the structure exists, not what it's delivered. The test is whether this team turns coordination into doses and tracers reaching Butembo-adjacent zones, and we can't get that from a launch announcement.
Right. Pan-continental coordination is the right instinct. I just want to see it land somewhere with a case count before I call it historic.
From Xinhua.
During the meeting, the two officials signed a handover certificate formalizing China's $2 million in emergency support for Africa's Ebola response, Kaseya disclosed in a statement via X on Friday, formerly Twitter. The Africa CDC chief lauded China's timely solidarity and strong partnership in support of the African continent's response efforts against the continued Ebola outbreak.
So here's the split screen I can't shake. The U.S. has tightened entry restrictions on this outbreak, and the Africa CDC is on X, publicly thanking China for $2 million. 2 responders, 2 very different postures.
And the $2 million is real. Formalized, handover certificates signed in Addis Ababa per Xinhua. But Daniel, the thing I want to pin down is where it lands. A check signed at a headquarters in Ethiopia is not yet a dose or a glove in Mongbualu.
Right, that's exactly the gap. Earlier this week, we heard the IOM was running a serious funding shortfall. Does 2 million from China start closing that? Or is it a rounding error on a 1,200-case outbreak?
2 million is a meaningful gesture, and it's still a small fraction of what a multi-country response costs. Xinhua, understandably, leads with the gratitude, not the logistics of where the money goes next.
If you follow Ebola Watch for clear outbreak updates, you may also like Hantavirus Watch. Daily updates on the 2026 outbreak, the MV Hondius Andes virus cluster, CDC and WHO response, contact tracing, and traveler risk. Find it wherever you listen to podcasts. Links to every story we covered today are waiting in the show notes. So if one caught your attention, you can head there to read more. That's Ebola Watch for today. This is a Lantern podcast.